Hello, and welcome to our CLABSI Quality Improvement Project presentation, presented by Andrea Avila, Nicole Bailey, McKenna Cox, and Jordan Kazarian.
First, we will begin by identifying the issue at stake. What does CLABSI stand for? CLABSI stands for Central Line Associated Bloodstream Infection, and it is defined as a laboratory-confirmed bloodstream infection, which is not related to an infection at another site and develops within 48 hours of a central line placement. CLABSI is a common healthcare-associated infection and accounts for 250,000 cases in hospitals annually. Despite preventative measures, it remains a prevalent issue, particularly in intensive care units and other settings where central lines are frequently used. Why is CLABSI an issue? There are numerous issues that arise from CLABSI infections, and the impact on patients is among the biggest problem as it can lead to serious complications. Patients who develop CLABSI may require additional treatment, and in severe cases, it can result in fatalities. Besides increasing morbidity and mortality rates, it also prompts longer hospital stays and adds to the financial burden of the patients. Many cases of CLABSI are preventable with proper adherence to infection control practices. However, lapses in adherence to protocols, inadequate training, and variations in healthcare practices contribute to the persistence of CLABSI, which adds to the economic burden. The financial impact of CLABSI is significant. Treating these infections adds to healthcare costs, and hospitals may face financial penalties related to healthcare-associated infections. CLABSI also involves the use of antibiotics for treatment, and the overuse of antibiotics contributes to a broader issue of antibiotic resistance, making it more challenging to treat various infections. Overall, CLABSI rates are often considered indicators of the quality care within a healthcare facility. High CLABSI rates may suggest flaws in infection prevention practices and overall inpatient safety.
Looking at quality variants, central line associated bloodstream infections are a healthcare concern across the United States. On average, around 250,000 CLABSI cases occur in the United States annually, with 80,000 of those cases being acquired in the ICU. During the pandemic, the CDC saw an increase in CLABSIs of around 7%, and the ICU setting was a major contributor in that increase. Central line infections make up about one-third of the 100,000 healthcare associated infection deaths in the United States annually. A patient's mortality rate goes up by about 12 to 25% when acquiring a central line associated bloodstream infection. Estimated costs per CLABSI range from about $12,000 to $94,000, with the average cost being about $48,000 per case. CLABSIs increase patient stays by about 10 days in order to provide adequate treatment. After analyzing the data we collected, we honed in on the CDC finding a 7% increase of CLABSIs across the nation between the years of 2020 and 2021. This increase of CLABSIs caused us to dive deeper into possible root causes of increased central line infections. We believe that during the COVID pandemic, efforts, new policies, and education were geared toward fighting COVID-19 and educating nurses on how to care for these patients. With CLABSI prevention efforts declining during COVID-19 and infection rates going up, we believe education in the acute care settings need to improve and be redirected towards CLABSI prevention and proper central line care. Educators and other administrative staff need to find better ways to improve education on central line care, CLABSI prevention, and nursing support.
The scope of the problem surrounding central line associated bloodstream infections involve multiple stakeholders across the healthcare system. It is important to understand these stakeholders because they all provide insight to the complexity of addressing and preventing CLABSI. Patients are the primary stakeholders as they are directly impacted by this infection. It could lead to prolonged hospital stays, increased healthcare costs, and in severe cases, adverse health outcomes. Patient safety is amongst the biggest concern. Healthcare providers are another stakeholder. This includes your physician, nurses, and other healthcare professionals that are involved in the placement and the maintenance of the central lines. They also provide education for families and patients on the aftercare of their PICC lines, but their adherence to the infection prevention protocols, proper insertion techniques, and ongoing monitoring play a crucial role in preventing CLABSI. Infection control teams are responsible for implementing and monitoring infection prevention practices within their healthcare facilities. They play a crucial role in educating healthcare providers, conducting surveillance, and implementing strategies to reduce CLABSI rates. Hospital administrators are accountable for the overall quality and safety of patient care. They allocate resources, set policies, and establish a culture of safety within their organization. Administrators are key stakeholders in supporting initiatives to reduce CLABSI rates. Regulatory bodies, for example, the CDC and other government agencies, set standards and guidelines for infection prevention. They mandate reporting requirements and enforce penalties for healthcare facilities with the highest CLABSI rates. Compliance with regulations is crucial for maintaining accreditation and ensuring their patient safety. Nursing schools, medical schools, and other educational institutions play a crucial role also in training the next generation of healthcare professionals. Their curricula and training programs influence the knowledge and skills of healthcare providers related to CLABSI prevention. Family members are often involved in the care of patients, and their awareness and adherence to infection control, something as simple as hand hygiene, can contribute to the prevention of CLABSI. Researchers can contribute also to the understanding of risk factors, preventative measures, and innovation in CLABSI prevention. Their work informs evidence-based practices and contributes to the ongoing improvements in patient care. The CLABSI problem requires a collaborative effort amongst all stakeholders. Successful prevention strategies involve education, continuous monitoring, adherence to guidelines, and commitment to patient safety across all levels of the healthcare system.
The solution to reducing the rate of CLABSIs is to educate staff about what they can do to help reduce and prevent rates. Nurses are the first line of defense in reducing CLABSIs, so educating staff on aseptic and sterile care of patients with central venous lines can reduce the occurrence of infection. Care bundles are essential for preventing CLABSIs. They can improve patients' physiological state, hospitalization satisfaction, reduce the time spent in the hospital, as well as ease the financial burden on the healthcare system. The improvement goal we would like to see is a quarterly reduction in the occurrence of CLABSIs. And part of implementing our solution, we composed a survey to get a baseline of the nurse's knowledge on what a CLABSI is and ways to prevent it. We will reassess the nurse's knowledge by using the same survey we used prior to implementing the CLABSI bundle to see if our interventions were effective. We would also like to incorporate central line care at Nursing Skills Day. This will help reinforce the skills and knowledge of how to use sterile technique when handling a central line. So the CLABSI Care Bundle is a toolkit collection of supporting document, resources, and tools to assist hospitals in implementing the bundle. The CLABSI bundles cover central line insertion, maintenance, and monitoring. Uh, we also created a self-auditing tool for nurses to ensure compliance to CLABSI bundles. So this auditing tool includes a checklist of central line care, such as observation questions like: Is the dressing changed and dated? Is the site clean and not oozing blood? Are alcohol caps present on all ports? Is the occlusive dressing changed, clean, dry, and intact and not peeling back? Is a bio patch or CHG patch placed correctly? Documentation also would include: did the patient have a bath within 24 hours? Was the dressing changed every 7 days? If so, when? Has the doctor documented the indication for the central line? Our monitor compliance would include a buddy system requiring that two RNs must be present when changing the central line dressing. This would ensure that sterile technique is adhered to while changing the dressing. So this slide is just a visual aid on solutions on how to reduce CLABSIs. The first picture here shows a central line that is soiled and definitely needs to be changed. Any dressing that is soiled needs to be changed right away in order to prevent infection. This middle picture here just shows an example of what the CLABSI Care Bundle checklist is. And it gives a nurse an opportunity to check off if they're being compliant in caring for the line in order to prevent CLABSIs. And then this last little picture or illustration here just shows, talks about what indications are for a central line. Um, and if there aren't any indications for the central line, then the nurse can talk to the provider about getting in order to DC it, because if the patient doesn't need it, well, then the line can come out, because we definitely want to reduce the risk of the patient acquiring a CLABSI. Our timeline includes how we want to move forward with implementing our interventions and reassessing them to see if we were successful. So by October 2nd, the nurses completed the survey on CLABSIs. This gave us a baseline of nursing knowledge on CLABSIs and CLABSI prevention. By October 9th, there'll be biweekly stakeholder meetings. Nurses will meet with team leaders and managers to continue um, discussing the importance of CLABSI prevention and discuss quarterly CLABSI rates, and see if the implementation of education on CLABSIs and CLABSI prevention has been effective in decreasing the rate of CLABSIs. Also, there will be unit in services of dressing changes of central line per hospital policy. This will be done and checked off by the RN at least once a month. This ensures that nurses are empowered with feeling confident in sterile dressing changes, as improper dressing changes are one of the causes of CLABSIs due to microorganisms introduced to the patient by break in sterility. October 23rd, we hope to have the nurse self-assessment or auditing tool piloted around this time. We're not sure if this will happen, because the assessment tool has to be approved by hospital administration. January 2nd to April 2nd, 2024 would be our 3 to 6 months analysis to see if our interventions were effective.
So during the study or analysis phase of our project, we wanted to determine, based on the surveys, that whether or not nursing staff self-reported adequate knowledge of CLABSI prevention measures. So this includes if they were aware of all appropriate measures to prevent CLABSI, such as clean and dated dressings, the frequency of dressing changes, sterile caps, biopatches, as well as isolated lines with labeling. In this phase of our project, we also wanted to determine the costs of implementing the protocol, which are fairly low considering a short paper survey does not really incur any sort of large amount of cost to the facility, versus the savings due to the decreased rates of CLABSI, if effective. So our next step, the acting phase, is to implement self-assessments of CLABSI care for all staff nurses in the facilities that we will go forward with this. We also will plan to supply CLABSI audit tools and make them available in the nurses station. Charge nurses will be informed and keep track of patients with central lines and ensure that the audit tool is completed every 12 hours for these patients. This will help to monitor whether or not the central line care is being performed correctly. And as we said, we found that the education was not necessarily the issue, so we are moving on to a more a different approach in order to determine if we can decrease CLABSI rates. We also want to analyze these results over a longer period of 3 to 6 months. Overall, addressing the scope of the CLABSI problem involves a multifaceted approach, including strict adherence to infection prevention protocols, ongoing staff education, surveillance, and continuous quality improvement initiatives within healthcare settings.